Yeah.
How many times have you seen the second in, whoever that happens to be, attempt to take command of the call, and that actually ends up being deleterious? That actually ends up resulting in harm because they've negatively affected rapport with the patient, or there was something that had some diagnostic momentum that ended up getting missed, overlooked, etc., because this other person swooped in and completely changed the trajectory. How many times have you guys seen anything like that?
I used to have that on the regular because there's one individual that always show up and take over the scene every time. Yeah. And he would always apologize. I think he was just always amped up with any emergency that happened. And it could be a simple call. It'd be a nosebleed or something like that. And he would insert himself between me and the patient when I'm talking to him. And every time, like, hey, man, I'm really sorry I did that. I'm like, well, if you're really sorry, stop doing it. Right?
Box out.
Yeah.
Teach the crew to box out. So you got 4 guys around, and they're trying to get in there, and you're boxing them out.
Yeah, and you're like, dude, you just totally disrupted our whole flow here.
Or they're asking a question you asked 5 minutes ago, and
asked and answered.
What's interesting to me, though, I think people with some experience that have experienced egos for a period of time and all that, they realize when people do that, it's because they're so uncomfortable. They're not comfortable with the situation. They feel insecure maybe in their own care, and so they feel like they got to take over, right? And it's a lot to trust somebody else to do that. You're not the only paramedic in the world, right? We're all a team. We should be. Let's work as a team.